Hey guys, my name is Dr. Thomas Agopian. It's good to see you. If you're watching this video, that means that you're either really curious about my page or you're about to undergo a thigh lift in some way, or meet with me or Jane or Mallory for pre-op for a thigh lift. This video is not intended to be flashy or fun or exciting or get lots of views on YouTube. It's meant to be really informative to the patients that may be undergoing surgery with me here in the future. So if you are, thank you for trusting me with your care. I hope this video you find educational and then allows you to ask any questions you may have at your preoperative appointment. But this is meant to give you a large amount of information about a thigh lift and help maybe clarify some stuff beforehand. So thanks for watching this. So what is a thigh lift? A thigh lift is a surgery that's basically intended to remove extra skin from the thighs. There's a bunch of different ways to do a thigh lift, and we'll go over the individual plan for you at your preoperative appointment or in the preoperative area at the surgery center or hospital where we're going to be performing this. But basically, the basic idea is people have excess skin on their thighs for one reason or another. Sometimes it's from lipedema, sometimes it's from massive weight loss, sometimes it's from aging. But regardless, there's more skin than we need to have on the thighs. And the surgery removes that extra skin. It basically is exactly what it sounds like. In general, there'll be an incision inside the groin that lifts upward on the extra skin on the inner thigh and around to the back of the butt. That usually also runs a little bit onto the front of the thigh, kind of all in the groin where the bikini would lie on into the thigh crease. A lot of times there's also an incision that goes down the thigh on the inside of the thigh, sometimes from the groin all the way to the knee if it's really severe, but the length of that incision depends on where the extra skin is. The point of this surgery is to remove some or a good portion of the excess skin. The net result of that is that you have a lower circumference or less skin either on the inner thigh or a lower circumference of skin around the thigh itself. This can be done for medical reasons, this can be done for cosmetic reasons. Regardless, it's kind of all the same. The skin, as we age or with massive weight loss or with weight gain and weight loss, loses elasticity. And you can think of skin like a balloon. When you have a balloon that's fully stretched out and then you age or you lose a lot of weight, that balloon, the elastic nature of the balloon kind of goes away, and then you start to see crinklies and wrinkles and stuff. That happens naturally over time as we lose elastin in our skin and as the collagen layer of our skin begins to thin. It also happens with massive weight loss. It also happens with lipedema and high volume evacuation of fat for that disorder or disease. Regardless of the reason, we're now left with a skin envelope with generally poor quality skin that doesn't really stretch much, and then you can see it. It gets in the way. Sometimes it causes rubbing. Sometimes it causes clothes to fit very poorly. Sometimes it just looks really bad. And that's what a thigh lift does. So sometimes you can also have extra skin on your knees and you can have extra skin on your calves. And if that's severe, we can do what's called a calf lift or a knee lift, sometimes called a calfplasty or a knee-plasty, you could call it. But essentially what it is over the knees is if you have enough hanging skin over the knees and you have kind of a wad of skin that hangs over the knees, you can make an incision directly on top of the knee and remove the extra skin over the knee. This is usually only saved for the most severe cases of knee skin excess because as we age, remember, we lose elasticity in our skin. In order for your knee to fully flex, it needs extra skin over top of it. So usually people with extra skin above their knee, when their knee is in full flexion, kind of bent inward, you won't see that extra skin. That extra skin will be used to help with flexion of the knee. When you put your knee in extension or straight leg, you then see the extra skin. When you're young and you have lots of skin elasticity, that extra skin recoils up the thigh and you don't see it. But as we age or for any reason you have extra skin, you now see that extra skin above the knee and it doesn't look very good. We can remove some of it, but not all of it. If we were to remove all the extra skin above the knee, what would happen is you wouldn't be able to flex your knee, which is a really big problem. So we can remove a little chunk of it sometimes. That's usually only reserved for cases of pretty severe extra skin above the knee, not for mild cases, because it does risk losing range of motion in the knee, and it also leaves a big scar across the top of the knee, which is impossible to hide. For a calf lift, some people have enough extra skin to warrant skin removal on the calves or the lower leg. I typically do that in the posterior aspect of the leg, which means from the back of your knee all the way down to your Achilles tendon, directly in the back. That can also be done on the inside of the leg, but really there's no good way to hide that. I've found over time that wounds tend to heal a lot nicer if they're done right on the back of the leg. It can be done either way. That's again only for people that have pretty severe amounts of extra skin on their calves, or for people that really don't mind a scar at all. And we can talk in your preoperative appointment if that's right for you or not, but most people already know ahead of time whether that's going to happen or not. There's a couple other devices that can help with skin tightening during a thigh lift. So after you remove the extra skin and you close, the skin is as tight as it can be during surgery or just immediately after surgery. What happens over time is about a third of the skin that I remove comes back after it stretches out and the swelling goes down. A lot of people don't like that. One thing we can do, there's two devices I like to use that help tighten the skin during a thigh lift. One is vaser, which is ultrasonic liposuction, and that's for people that have any fat in the skin that we're not removing, the front of the thigh, the back of the thigh, the sides of the thigh. If there's liposuction to be done, using a vaser can help remove the fat in an atraumatic way, so there's a little less bleeding, bruising, a little less trauma, and it also helps tighten the skin afterwards. And then there's another device called bodytite, which is a radio frequency skin tightening device that you perform at the same time as liposuction. This can also help tighten the skin and thicken the layer of collagen over time. Both of these devices are adjuncts to thighplasty that can help give you a little bit better of a result over a long period of time. These devices are sometimes available at the surgery centers we're operating at, sometimes they're not, depending on where we're going, and they're only appropriate for certain people. If you have really poor quality skin, you're probably not going to see much difference with these devices. It's kind of like everything else in life. It's usually a little bit better, and your results are going to be better the younger you are and the better your skin is. You can talk to us in your preoperative appointment, or even before. You can send us a message and inquire about these devices if you're asking for them. Insurance does not cover either of these things. The overall outcomes, I would say, range from 10 to 30% better depending on your skin quality going into the surgery. The benefits to this surgery are kind of dependent upon why you're going into it. You can expect your leg to look a little bit better after this surgery. You can expect to see less skin. You can expect the overall circumference of your leg to be smaller. You can expect to fit into clothes better if your legs were disproportionate going into surgery. And you can expect to just generally have smaller legs with less extra skin. That's the main benefit of the surgery. If you have lipedema, and we're doing it for that, you can expect less nodules and tenderness on the inside of your leg when we remove as much lipedema tissue as we can with this surgery. If this is purely a cosmetic surgery for you, then you can expect a better looking leg. That's the main benefit. So what are the risks of this surgery? There are a number of risks to this surgery. I like to tell patients about a thigh lift, or generally in plastic surgery, there are really good procedures that we've refined over many years that are just awesome procedures. A tummy tuck is an awesome procedure. We are really good at it. We've refined it over time. We can get reliably good results on most people that are very long lasting with a very low complication rate. It's a great procedure. A deep plane facelift is another one. It can be reliably, safely performed. It can look very natural, and the results last a lifetime. It's a great procedure. There are procedures that are okay. A mastopexy or breast lift with an augmentation is an okay procedure. It has a relatively high complication rate over time, but is a pretty good procedure. Same thing with an arm lift. It's a pretty good procedure. Not as good as a tummy tuck, not as good as a facelift, but It's a pretty good procedure. And then I have procedures like a thigh lift. A thigh lift carries a very high complication rate. Overall, the complication rate with a thigh lift can approach 78%. What that means is that this surgery, many people have some problem afterwards. The most common by far is a wound. So we are putting incisions under tension in a groin area where there's lots of friction. Typically there's a 3-point incision, so there's a horizontal and a vertical incision, and where they meet, there's trouble healing that, and that's uniformly across all of plastic surgery. Whenever you have perpendicular incisions meeting, you have trouble healing that. And then on top of all that, we put that in an area that's moist, and it has to be has a lot of friction associated with walking. So the combination of all of those things leads to a very high rate of wounds. It is pretty common to have a small wound somewhere along a thigh lift incision. That's what leads to the high complication rate. Other complications that can happen that are relatively common are poor scarring. The thighs generally are a poor scarring part of the body. Some parts of the body scar really well, like the breasts and the lower abdomen. Some parts of the body scar very poorly, like the décolleté of the chest and the upper back. The thighs are somewhere between the two. Other things that can happen over time, the scars can migrate down as your skin loses elasticity. The scars that were nicely hidden at one point in your life are no longer hidden. And that can be concerning for some people. Also, fullness will come back, particularly in the upper inner thighs. I have a number of patients that at the end of surgery, they had a large thigh gap, and then by 6 months post-op, that gap had closed as extra tissue comes back. The skin of the thigh does tend to stretch out more than other areas after surgery. It's for these reasons you'll see a lot of plastic surgeons don't do a lot of thigh lifts. Most plastic surgeons don't like doing thigh lifts. I do more than most people in the country. I do a ton of thigh lifts, usually between 2 and 4 a week. I'm kind of used to it, but there are a lot of downsides to the surgery itself. The rare complications that can happen but are very uncommon, things like labial spreading. We're going to anchor the thigh up on the inner thigh. If you anchor it to the skin, or over time, sometimes even if you do everything correctly, the labia will start to spread as the thigh kind of descends. And that can cause vaginal dryness, and it's very hard to correct. In order to prevent that, we anchor the thigh skin to the pelvis, to the fascia of the pelvis. It's very strong, but those sutures hurt. And so it's a little bit more painful than other surgeries post-op because of those large anchoring sutures that we have to use to prevent labial spreading. Other things that can happen, lymphedema is a chronic condition of swelling in the legs due to damage to the lymphatic channels and the lymphatic system of the legs. We're operating the major lymphatic system of the legs is on the inner thigh, right where we operate. This is more of a classic complication as opposed to a modern thigh lift where we use a lot of liposuction, which is lymphatic sparing, and we try to remove just the skin and not all of the lymphatic channels that go along with it that are underneath the skin. But even with all that, despite our best efforts, sometimes people can have chronic swelling of the leg after a thigh lift and chronic lymphedema, which can be really hard to correct and or treat. And then infections are not common, but they do happen. Usually it requires some antibiotics. If the incisions get soiled with feces or urine, that could raise your rate of infection quite a bit. It can be hard to care for these things after surgery. We'll talk a little bit about that afterwards. Those are the main risks of a thigh. And then poor scarring can also happen. We talked a little bit about that. Those are the big risks for a thigh lift. We're going to present you with informed consent documents from the American Society of Plastic Surgeons sometime at your preoperative appointment or just before. Please take the time to go through those documents and read them thoroughly. So the alternatives to this surgery. For most people undergoing this procedure, there really aren't any reasonable alternatives. You can wear compression or compressive clothing that can hide the extra skin if this is done for a cosmetic reason, and that can be a reasonable alternative. You just look better in clothes, but it doesn't really address how you look when you're out of clothes. Additionally, that vaser, bodytite, or Renuvion, there's other non-surgical skin tightening devices. Those are the best ones, but there are other ones, and as this video ages, there may be new technologies that come onto the market that can help address skin tightening without surgery or without skin removal. As of now, these devices are only pretty good for people with mild to maybe moderate amounts of skin excess and good quality skin. If you're watching this video, you probably don't have that. You probably have more severe skin excess that is not going to be amenable to non-surgical skin tightening or minimally invasive skin tightening. Those are your general alternatives. So the burdens of this surgery, there is a scarring component to it. The scars from this surgery are not well hidden in a lot of cases, or not as well hidden as other scars are on other parts of the body. And so that can be burdensome to people to think about hiding the scars. Scars will remain red usually for a long period of time, depending on your skin tone. They will eventually become skin colored in most cases. However, sometimes they don't, and that can provide some concern for patients. Other burdens from this surgery, the initial post-operative burdens, the weightlifting restrictions we'll talk about, and there's a lot of stuff in the immediate post-operative period. So what do you need to prepare for surgery? We will need a compression garment. We generally recommend patients bring us one compression garment on the day of surgery. That's usually a pair of trousers that goes from the abdomen to the ankles. It should be something that's really tight on you now, but fits, or if your current size is really large on you, then you'll need one size smaller. We only want one single garment, and if you bring us more than one garment, we might lose it, and those things are expensive. So generally try to bring us one garment. You should have a set of garments after surgery, because there is some leakage that occurs from the liposuction sites or from the incision itself sometimes, and so having another set that you can wash and put on and change between can be helpful sometimes. Crotchless is sometimes helpful for people after this, because it can be hard to get these things on and off with all the incisions, and so going to the bathroom can be difficult, but people do well with either. And then our favorite brands are Mirena for post-operative compression or Lipoelastic. Those are the ones that seem to be the easiest to get on and off. People have brought us Cialis and every brand you can imagine we've tried and seen. The ones that are more synthetic and easily slide on and off, or have clips and zippers on the side, tend to be a little bit better. For medications, we are going to see you at your preoperative visit, and we will prescribe you medications based on your specific needs. There's a bunch of different ways to manage pain. There's a bunch of different ways for antibiotic prophylaxis to prevent infection, and then some people need blood thinners as well. Some people don't. It depends on your specific risk factors. So we'll talk about the medications at your preoperative visit. Generally speaking, though, we'll be able to prescribe medications to wherever you are and have you pick them up before surgery. We cannot prescribe narcotics across state lines. So if you're out of the state of Georgia, you'll have to pick up the narcotic when you get here. A family member over the age of 18 can pick up your prescriptions with a photo ID. Generally speaking, we prescribe the following medications. We generally prescribe an antibiotic for up to 7 days, although sometimes longer, depending on the surgery that you're getting and how much liposuction needs to be done and your own personal risk factors. The antibiotic we most commonly prescribe is one called Duracef, which is a cephalosporin type antibiotic. We will prescribe an antibiotic ointment. It's called Mupriacin, also known as Bactroban, and you apply that to your incisions according to our postoperative instructions. We also usually prescribe an anti-nausea medication in case you get nauseous with any of the pain medications or anesthesia itself. It's called Zofran, also known as Ondansetron. And generally we prescribe a narcotic pain medication. This sometimes can be part of a extended recovery after surgery protocol. Sometimes this is standalone. It kind of depends. Generally speaking, this surgery is not particularly painful. It's just uncomfortable to have to wear compression, to have incisions in your groin, and to get up and move around. Sometimes the anchoring stitches can be very painful, and some patients do have issues with pain. I would say the average patient takes pain medications for somewhere between 3 and 7 days after this surgery. It is good to switch to Tylenol and Motrin as soon as you can. Motrin in particular is an amazing pain medication after surgery. It works really well for surgical pain. If you are taking Tylenol, you got to make sure not to exceed 4,000 milligrams of Tylenol in a day. We typically will write for Percocet or Norco, which is also hydrocodone, and those medications, those pain medications, contain 325 milligrams of Tylenol in them. You do not want to go over 4,000 milligrams of Tylenol in a day. Other things to prepare. There's a soap. It's called Hibiclens. It's a chlorhexidine soap, and it's an antimicrobial, a very powerful antimicrobial soap. We will have you shower with that soap for 3 to 5 days before your surgery. This decolonizes your skin and has been shown to reduce post-operative infections in many fields of surgery, including plastic surgery. You can get this at CVS, Walgreens, Walmart, Target, or Amazon. This soap will dry out your skin. You can use moisturizers and lotions for up to the time you shower before surgery. The shower that you take that's going to be closest to surgery, we don't want you to put anything on your skin. So many people come to surgery with dry, ashy skin. That's okay. If you come with lotions and moisturizers on your skin, we will have to remove them, and they can interfere with your wound healing. We also like patients to purchase something called a hypochlorous acid spray. The common name for this is wound cleanser or Vashi, V-A-S-H-E. This is a gentle spray. It's an antimicrobial solution that may decrease your incidence of infection. It may also promote wound healing. There is some evidence for both of those things. You can purchase this on Amazon and in some drugstores. What we'll have you do with that is once the dressings come off the incision, we're going to have you shower each day with soap and water. It doesn't have to be Hibiclens. It can be any soap, preferably one without a lot of perfumes in it. You'll pat the incisions dry, and then you'll spray them with Vashi, and then follow the remaining wound care instructions. To decrease the risk of skin infection, we ask that you remove hair in the bikini line, so basically shave anywhere I'm going to be making an incision, 2 to 4 days before surgery, and that you can do shaving or waxing. We don't want you to shave the night before surgery because nicks in the skin can increase the risk of infection. So if you nick yourself shaving or have micro nicks after shaving or waxing, we want to make sure those are closed before we go to surgery, and so we ask you to do this 2 to 4 days beforehand. Some optional things that you can purchase that could help ease your recovery. Chucks pads, which are disposable, washable, puppy pads, or absorbent pads to manage drainage from liposuction sites. If you're getting a lot of liposuction to your thigh lift, there'll be a lot of drainage that comes out. And so having these things around, you can tape them to your thigh. If you have an awful lot of drainage, you can just sometimes put them on chairs and stuff. That can be helpful. You may want to get a box of gloves so you and your partner can do dressing changes or remove the garments without getting yourself too dirty. Sometimes people will purchase a waterproof mattress cover or a shower curtain, especially if you're getting lots of liposuction. A shower chair can be helpful sometimes in the first few weeks after surgery, however, isn't strictly necessary for a lot of people. A seat cushion for the toilet, a female urinal, a toilet riser, or a lift chair may be beneficial depending on your certain situation. Most people will not need that kind of stuff, but if you're already impaired mobility, it may be nice to have. Electrolyte drinks are good to have around because you're going to get dehydrated after surgery if you're not careful about how much fluid you're intaking. We need you to take in a lot of fluid, and the fluid should have some electrolytes in it. So we like things like Liquid IV, Gatorade, coconut water, Body Armor. There's a number of drinks out there. We want you to have some drink that has glucose in it. Your gut needs glucose to transport electrolytes across it. So if you drink sugar-free energy drinks or electrolytes without any glucose, you're not really going to do much. Bone broth or nutrient-dense soups can also aid in helping keep you hydrated. Protein drinks can help promote wound healing. The time after surgery is not a time to calorie restrict. We need you drinking and eating lots of calories after surgery. We would like you to be on a diet which is consistent of healthy proteins, meats, complex carbohydrates, and vegetables. Basically a healthy diet. A Mediterranean diet would be great, but not a calorie restricted diet, not a diet where you're in ketosis, not a carnivore diet, a regular diet with a good mix of lean proteins and carbohydrates. Ideally, ones that have fiber as well. The pain medications can make you constipated after surgery, and so having a diet rich in fiber is important to make sure that you don't get too constipated and that stool doesn't get too firm. Probiotics can be helpful to take sometimes when you're on the antibiotic after surgery. Iron supplementation. We ask you to take iron supplementation for 30 days before surgery. This can help build your iron stores and get your hemoglobin and hematocrit as high as it can be before surgery. You will lose blood during this surgery. Most people lose a substantial amount. Not enough to need a blood transfusion, but enough to make you feel pretty crappy. We've noticed that since we started patients taking these iron supplementations for 30 days before surgery, our rate of needing a blood transfusion has gone down quite a bit, and it makes the recovery a little bit easier for most people. You'll continue taking them after surgery as well. Laxatives and stool softeners are a must after these procedures if you're on pain medications. The pain medication will make you constipated. It is not good to be constipated after surgery. This surgery gets really uncomfortable as it is, and being constipated on top of it will make your recovery pretty miserable. So, while you're taking any narcotic pain medication, you should also be taking a laxative. We like Miralax, Senecot, Metamucil is good, but generally you want to be taking at least a couple of these. We like when people take Metamucil, psyllium fiber, plus Miralax, something along those lines. Non-woven gauze. So it can be helpful to have non-woven gauze or Interdry. Interdry is a drying pad meant for skin folds. And you can use these things to put in the groin to help control moisture. One of the reasons people get wounds is friction, but also moisture in the groin. And so what people can do is you can take Interdry and put it in your groin underneath your compression garment, and then change it out as it gets moist. This will help prevent some of the moisture in the groin and can help prevent wounds. Non-adhesive pads such as Telfa or Telfa Islands or any generic non-adhesive pad or bandage can help protect the incision from the garment. So your incisions are going to be underneath your compression garment. Once we take off the surgical dressings, which need to be changed typically around a week, the incisions will be exposed to the garment. Sometimes it's nice to have an additional barrier between the incisions and the garment, particularly if your garment rubs or is a little bit abrasive. Telfa Islands are a great dressing for this. They're basically a small cotton dressing with a non-adherent pad on the side, and so you can put on antibiotics over the wound, a moisturizer over the wound, and then apply a Telfa Island, and then apply a garment over top of that. So to prepare immediately for surgery, you'll have nothing to eat or drink starting the midnight before surgery. So midnight before surgery, nothing to eat or drink, no water. If you take a GLP-1 medication, Ozempic, Wegovy, Mounjaro, Zepbound, or any semaglutide, tirzepatide, any of those medications. Generally speaking, if you've taken them within the last 3 months, you must be on a clear liquid diet the day before surgery. Now, this recommendation may change as this video ages, so please ask us in your preoperative appointment what the current recommendation is for these medications. At the time of filming, though, we are having people be on a clear liquid diet the entire day before surgery. That means nothing solid to eat or drink for at least 24 hours before surgery, and then starting midnight, nothing to eat or drink at all. Clear liquid diet means things like Jell-O, clear broths, water, coffee without cream or sugar, things like that. You'll also want to make sure your home is organized in a way that minimizes your physical activity. We want you to be up and walking enough to not get a blood clot after surgery, which is generally for 5 minutes every 2 hours. But the less activity you do in the post-operative period, the less likely you are to have wounds. A lot of people, especially people that are in really good shape, tend to feel pretty good after this surgery and tend to do a lot of activity. Unfortunately for this surgery, the more friction you put in your groin by walking and moving around, the more likely you are to have a wound. So we've noticed that people that do less, at least for the first 3 weeks, tend to do better when it comes to wounds and scars and healing. So you'll want to optimize your living environment for that kind of level of activity. Having a nice chair set up is good. Having food within reach that's easy to get to is nice to do. Having a plan for who's going to care for you. Now you'll be able to care for yourself. You'll be able to wash, bathe, and clean yourself and make food, get food, prepare food, that kind of thing. But having some help can be nice after surgery. And just optimizing the environment that you're in. If you're able to sleep downstairs for a few weeks, that might be helpful. You will be able to climb stairs if you need to, but sometimes it's good not to if you can avoid it. There's also a list of medications that you can't take before surgery, most notably metformin or ACE inhibitors. But there is an entire list of medications. You should meet, if you're having the surgery in the hospital or the surgery center, you should meet anesthesia beforehand, and they'll review the entire list of medications and talk to you about which ones you can and can't take. Most supplements should be stopped 1 to 2 weeks prior to surgery. And there's a long list of things. But generally speaking, if you're taking a supplement, you probably shouldn't take it approaching surgery within the last 2 weeks. On the day of surgery, you'll meet with me in pre-op and we'll do the markings. The markings are rather complicated. We'll discuss incision lengths. I'll show you exactly where I plan to put the incision on your particular leg. And I'll show you how much tissue I plan to resect. We'll discuss any areas of liposuction, any additional procedures, and we'll mark you up. The marking can be kind of intimate because it's in your groin. And so if there's any concerns with that, let me know beforehand. There's usually other people in the room when we do these markings. Just letting you know, it can be a little uncomfortable for people. Once the markings are done, you'll meet with nursing, you'll meet with anesthesia. The plan will be set in motion, and you'll be taken back to surgery. Generally speaking, most patients will stay overnight for at least one night after this surgery. If you're really, really healthy and it's a very small thigh lift, you might go home the same day, but generally people stay for at least one night, whether that's at our surgery center or whether that's in the hospital. After surgery, you'll stay in Atlanta for at least 3 to 5 days. I'd like to see you post-op for at least the first post-operative visit. Most patients go home from the hospital or the surgery center the next day. If you're undergoing a ton of lipo, or there's an issue where you can't walk or having too much pain, your pain's uncontrolled, we can keep you longer, but that's generally not necessary and is pretty rare to have to keep somebody more than one night for these procedures. So what does recovery look like? Recovery is generally not terrible. It depends on how much liposuction you get. If we are doing a lot of liposuction with this thigh lift, then the recovery tends to be a little bit harder. The recovery itself is not too bad. Again, we want you walking for 5 minutes every 2 hours to make sure the blood gets out of your legs. You don't have to wake up to do that, only while you're awake. We also don't want you to engage in much activity at all. There's no heavy lifting for 6 weeks, nothing that gets your heart rate up for the first 3 weeks after surgery. Additionally, the less you do, the better you will heal. We don't want you doing nothing. We need you to get up and move. We don't want a blood clot. But the less you do, the better you'll heal. The hardest part is going to be if you get a wound and then doing wound care. If you have a small wound, you can just apply some of the mupirocin ointment and place a bandage, such as a Telfa Island, over top of it. You'll do that twice a day until it heals. We can also guide you through that process. Again, wounds are really common after this surgery. I would say more people than not get a wound after this surgery that they need to go through and manage. At the end of that process, sometimes wounds take between 4 to 8 weeks to heal. Once the wound is healed, we can evaluate the scar. If the scarring is very poor, we can talk about doing a revision in clinic where we numb up the scar and remove it and reclose it. Most of the time that isn't necessary. The scars generally are well hidden on the inside of the thigh or in the groin, but sometimes it can be, and if it is, you'll let us know and we'll walk you through it. Recovery itself is not terrible for the surgery. There is some weakness depending on liposuction. There's some pain depending on those sutures I was talking about, the anchoring portions of them, but generally not too bad of a recovery. So for long-term results for this surgery, the long-term results are generally pretty good. Most people are happy they underwent this surgery. The number one complaint I get, besides wounds, is poor scarring on the legs. The legs, again, are not the greatest of scarred areas in the body. It can be hard. Scarring from this surgery can be hard to deal with. If we need to do a scar revision or scar modification along the way, we can. Silogen can help. Silogen is a silicone tape that goes across the scars. You have to leave on for about 18 hours a day. If you do that for 6 months, your scar quality will be a lot better. Sometimes the other big complaint I get is residual fullness of the skin, especially on the upper inner thighs. I will make your thighs as tight as I possibly can on the day of surgery. It's the nature of skin to stretch back out, and about a third of it comes back. I have a number of patients who I achieve a very large thigh gap on the upper inner thighs on the table that doesn't stay that way in the post-operative period. It can be annoying to me. It's annoying to you guys. The thing about a thigh gap is not many women have a thigh gap, and it can be really hard for some people to achieve that. I would say that for most people, it's not realistic to have that permanently after surgery, although some do. Generally, people are satisfied and like the results. There's a number of, if you'd like to see before and afters, I try to post as many of them as I can on my website. There should be a pretty big gallery of those. The things it's really good for is reducing the circumference of the legs and reducing the appearance of extra skin, particularly on the inner thigh and on the inner knee, up towards the groin. What it's bad at, it's not great at giving you smooth skin. Smooth skin is a function of the quality of your skin and how full it is. So if it's filled with fat, it's going to be smooth. It's also, if you're young, you have a lot of stretchy elastin and thick collagen, you're going to have smoother skin. A thigh lift doesn't really give you smooth skin. It kind of takes the skin quality you have now and makes you have less of it. It will tighten it. It will make it look better, but you can check out the before and afters. And if you see fine cellulite before, generally you see fine cellulite after. Vaser and bodytite can sometimes help that, but they're not magic either. And so most people, if you're doing this to treat cellulite, it's usually not a great option. I would say the satisfaction with this surgery hovers between 80 and 90%, which on the grand scheme of plastic surgery things is pretty low, but not as low as other things and not as high as other things. So is it a good procedure? It depends on where you start and what your goals are. And we can talk about that. Hopefully we've talked about that during consult, but we can talk about that more during pre-op if you have any questions or concerns about the goals of surgery. So this is a very long-winded and very boring YouTube. Thank you for watching the whole thing. We look forward to seeing you at our preoperative appointment. Generally speaking, what the preoperative appointment will be, we'll meet with you. We'll go over your health history, make sure nothing has changed with your medical status prior to undergoing the procedure. We're going to have you sign consent forms. We'll get prescriptions to you. We're going to discuss the procedure in detail, any special things we need to do for you. We're going to look at your medical history and see if there's any special precautions we need to take. We're going to check to see if you need medical clearance, if we have the medical clearance, if we need your cardiologist or pulmonologist or any other person to clear you for surgery. We're going to make sure we have that at that time. So if you need to get that done, please have that done before the preoperative appointment. If we don't have that during the preoperative appointment, then we won't be able to proceed with surgery. And so that can affect your scheduled surgery. So please get on that if you need to have that. We would have talked to you about that already if you needed to have that done. Generally speaking, people over the age of 60 or with significant medical problems will need clearance before surgery. We're also going to give you preoperative and postoperative instructions in the form of documents that you can read over that has a lot of this information. So these documents will have the most up-to-date and accurate information regarding preoperative and postoperative and all the recommendations that I've talked to you about in this video as well. And then as always, please feel free to reach out to us on our current messaging system, and we'll go forward from there. But anyway, thank you for letting me care for you. I hope to see you at pre-op and then at surgery. And it's going to be fun. It seems a little intimidating. There's a lot of things that go on with it. But afterwards, you get a lifetime of having less skin on your legs, which is always a good thing. So, all right. Anyway, take care, guys.